Okay, you okay there, Asif? Hello.
You're good to go, Dr. Tar.
Okay, welcome to our regular weekly program, the Guyana Dialogue. As you know, Guyana Dialogue is sponsored by a group of Guyanese resident in the UK, United States, Canada, the Caribbean, and in Guyana. Today we have as our guest the Honorable Minister of Health, Dr. Frank Anthony. As you know, he had served also as Minister of Youth, Culture and Sports in the previous PP government. And we are very fortunate to have him today. He's going to discuss various issues related to the health sector in Guyana. He will talk about challenges and accomplishments, etc. Now, before I will introduce Dr. Anthony now, but I just want him to have a look at these newspaper clippings that we are going to show at the beginning of the program. So if you can bring Dr. Anthony on the screen and then present the pictures one after the other. Yeah, go ahead with the pictures. Yeah, this is the Georgetown Hospital, and we had a note, advanced technology and expertise, and we have a few slides that will capture newspaper reports on the breakthrough in surgeries, medical firsts, and innovations at the Georgetown Public Hospital. Next slide. This was a guy who was suffering from renal failure. He went to the Georgetown Hospital and they saved his life. And he was talking to the press what the Georgetown Hospital meant for him and giving a second chance. Next slide. And this again is when the Georgetown Hospital successfully performed a kidney transplant with strictly local doctors. We know kidney transplant used to be done by overseas people with the George Sobrad Foundation. Next slide. This is the first time a mother was delivered a baby in a taxi in front of the GPS. This mother was told by a private hospital that she's not ready for delivery yet. And when she came, the doctors went out to the gate and ensured a safe delivery. Next. Now, blood transfusion. Now, the Guyana Public Hospital Corporation is free. It's delivered free to patients. So we want our viewers to know that. Next. And then this is a bleeding pregnant woman who was refused admission to a private hospital. And then they transfer her to Georgetown Public Hospital. Dr. Frank will speak. We'll ask him to speak a little more about this. Next slide. And this is a woman with obesity, and the first laparoscopic surgery was performed there again, which is the first for the surgeon and staff at the Georgetown Hospital Corporation. Next. And Georgetown Hospital also has an all-women surgical team. Very few hospitals in the world, if at all, have a team of strictly female surgeons. So that is a huge accomplishment. The reason why we show this, sometimes people tend to focus only on a few negative things and they forget all the great things and achievement done by the hospital and the Ministry of Health. Now, you can take off the slide and we'll ask Dr. Anthony now to comment on. I've been reading reports where people have been denied acceptance in a private hospital, then they send them over to Georgetown Hospital, and sometimes it doesn't end up good. So if you want to comment on that. process.
Sure. So thank you very much, Dr. Tara Singh. Thank you for having me in this program. First of all, I want to say that, Guyana right now is a very exciting place to be. And one of the mandates of the president is to ensure that we develop a world class health sector. And so we have been working on that mandate to be able to do so. And in some of the clippings that you showed, um, you can already see that we are making advances in the area of transplants. We have a transplant program where we've been doing kidney transplants. And over the last couple of years, we have done quite a number of these transplants for patients. And it's done by a local team who would have received training from various centers from around the world, but they're now back in Guyana and they're working together. Apart from kidney transplants, we've also been doing cornea transplants, and we have done more than 100 cornea transplants. But one of the things that was missing, we did not have legislation pertaining to transplants in Guyana. So last year, one of the things that we did pass was a legislation for organ transplant, organ and tissue transplant. And under that legislation, we have established a, a body that is now responsible for transplants in Guyana, as separate and apart from the clinical aspects. And we are now in the process of developing our donor registry, people who might want to donate organs to other patients, and building out various capacities. Just about 2 weeks ago, we had a team from Barcelona that visited Guyana. This is a team from the DTI, that's Donation Transplant Institute of Barcelona, that came to Guyana under the auspices of PAHO to review our program and to work with us on how we can strengthen the program. So, out of those discussions, we'll be having more training. They will be giving us technical assistance in developing several systems. So, we'll have a very close collaboration with them over the next couple of years. And so, you would see in the area of transplant that we'll be doing a lot more than what we're currently doing. Right now, for kidney transplants, we are only doing live donors, but in the near future, we would start doing cadaveric transplants, meaning you can harvest the kidney from, uh, you know, and be able to transplant it.
Okay, I just wanted to address a question where patients are denied acceptance in the private hospital and then they turn them over to Georgetown Hospital, and sometimes the result is not nice.
So
So,
during
go
the
on.
pandemic, one of the things that happened during the pandemic is that most of the private hospitals did not take patients if they suspect them to have COVID. And so everyone with COVID was sent to the public system and we had to manage them. So whether you're a pregnant mother or any other illness, once you had COVID, the
Mm.
private hospitals weren't taking you. So we dealt with that. We were able to successfully manage, most of the patients that come to us. And now I think we have gone back to some level of normalcy. So that right now is not occurring at the private hospitals.
There was a report a couple of days ago about some neonatal case where a child, the parent was saying the child was abused, etc. That child was referred from another hospital to the Georgetown Hospital. You
One of
could,
the we is at the Georgetown Hospital, we have a very large neonatal unit, and we are one of the few hospitals that offer neonatal services. So there are quite a number of private hospitals, but they don't have They they don't have neonatal units. They don't have the equipment. They don't have the skilled personnel to manage these children. And so, in a lot of instances, if there's a neonate that requires specialized services, that neonate would be referred to the Georgetown Hospital for care. And as you can imagine, because of their prematurity, they can have um, lots of difficulties.
Mm.
But as a public institution, we accept all patients. We don't have a
Mm.
choice. Once you come, we'll have to, manage you. And so we have been doing that for, these babies.
All right. I'm going to ask you a few clarification or a few questions on equipment and material drugs. But before that, if you can just comment on, I read a report. There are quite a few reports in the newspaper where $1 billion of billions worth of drugs, you had to dump them because they had expired, and those were drugs that were ordered under the previous regime. If you want to comment on that.
Yeah, when we came into government, we had a very chaotic situation where patients across the public health system were complaining that they were not able to get access to medication. And when we went to the what is called the materials management unit, we saw it stuck with a lot of stuff, but most of these things were expired, and they keep storing the expired medication, and they didn't have um, place for medication that was had the right dates. They were not expired. They didn't have space for that, so that became a problem. We had the audit department. They came in, they did an audit, and we found literally millions of US dollars had to be dumped because they were all expired medication. So we were able to do that with the assistance of the audit office. And once that was completed, we procured medication now that is in the system. And we are now procuring a wider range of medication, not just the basic things, but we have expanded the list of medication that we're offering to patients. So right now, all our health centers, health posts, district hospitals, regional hospitals, they all have meds. This differ from what obtained under the last government, where there were lots of shortages, lots of problems. Now we have medicines for the patients who come to our facilities.
I believe someone in Borbis was complaining. I saw a report that they didn't have eye drops in one of the health centers. You're aware of that case?
Yes, that's an unusual case because we don't put eye drops at the health center. Eye drops is I mean, you need a ophthalmologist to be able to dispense those eye drops. And so they were able to get it from the New Amsterdam hospital and give it to the patient. So they have specialized clinics where patients who need those types of services can go.
Mm.
And in New Amsterdam, there are two, in Barbies, there are two specialized clinic, one at the New Amsterdam Hospital. And as you would know, we also have the National Ophthalmology Hospital, which is at Port Morant. So once they go to those specialized clinics, they would get those
Mm.
medication. Unfortunately, the gentleman who complained, he did not attend those clinics and was not a member of the clinic, but we have rectified that and we
Okay.
ensured that he got his eye drops.
All right. Thank you. All right. I'm going to pass you on to my two colleagues,
Sure.
Professor Mahim Hariraj and Dr. Ganga Ramdas. I don't know if you know them, but Dr. Ganga was formerly head of the Department of Economics and International Relations at Lincoln University in Pennsylvania. He was also heading a desk at the Bank of Guyana before he migrated. And Professor Mahin is now teaching in a college in the Bronx. And so I'll pass you over now to Professor Mahin. You want to ask the minister?
Most definitely. Good evening, everyone.
Um,
Good evening, Minister Frank Anthony. How are you? I hope all is well. Minister, since you took over the reins of this ministry, we have seen a transformation in the state of the art medical delivery. But given the budget allocation, I think it was $84.9 billion in the 2023 allocation. One of the things that comes to mind is we are seeing erections of many private hospitals. And we also saw some interest from Northwell coming and partnering with the government of Guyana over a 5 year period. How do we have a barometer in place to hold private hospitals to the same levels of standards? And is the Medical Council of Guyana the body in charge of that, holding medical institution practitioners to a level of standard?
So thank you very much for that question. I think it's a very good question. One, in terms of professional conduct of, let's say, doctors, that's the purview of the Guyana Medical Council. So they, if anybody make a mistake, the general public can complain to the medical council. Investigation would be done, and based on the recommendations coming from that investigation, um, the worst that can happen to a physician is that they're taken off the list of physicians that can practice in the country. And there have been cases of that. So there is that mechanism. So they govern the conduct of doctors. We also have a similar body for nurses, the Guyana Nursing Council. And we have a similar body for dentists, a similar body for other allied professions. So the Allied Health Council. So there are all these professional councils that exist, and their purpose is really to help regulate the profession. Now, the actual facilities, that falls under a different body. There is a body under the Ministry of Health that is called the Technical and Standards Department. And you have teams of inspectors who would go out and inspect health facilities to ensure that they're complying with the minimum standard. And if they don't comply, then they're told what are the defects, and they're given a period of time to rectify those defects. And once those things are rectified, then they're issued with a license for the institution to operate. So this has been in place. We have a law called the Health Facilities Licensing Act, and under that law, that's how hospitals and health centers and so forth can be licensed.
Follow-up
Thank,
question.
thank you. Guyana is on this rapid transformation, and the world is looking at Guyana, so in tunely. Are we looking to digitalize medical records so there is a level of uh, continuity across the country? If somebody is in Barbados when they come to Georgetown,
Sure.
there's access to that medical record.
So that's one of the things that we are doing right now. You mentioned earlier that we are working with Northwell, and indeed we are. We have a 5 year memorandum of understanding with Northwell, and they're helping us in different areas in terms of training, in terms of helping us to do very complex surgeries and things like that. So that's a very good partnership for us. And just a few days ago, the head of Northwell Global, um, their global team, was in Guyana, and they brought a number of surgeons who were planning to do a trip back to Guyana in July so that they can help work with the colleagues in the Georgetown Hospital to clear up certain backlog of cases. So we've been doing that. That's one area that we've been working with Northwell on. Coming to the question that you just asked in terms of uh, electronic health record system. This is one of uh, the collaborations that we have with Mount Sinai. And Mount Sinai has a fantastic team of professors, people who got all the know-how in terms of uh, coming up with systems for medical records. And that team has been working with us in Guyana. And so far, we have completed legislation to protect patients' data confidentiality. Very soon, that legislation would go to Parliament. We have just concluded discussions on what the the parameters would be for an electronic health record system, and we are hoping that by mid of this year we will launch first of all a health application, a health app, where patients would have basic data. But the idea is that in a few years we'll have a very integrated patient record system. So when you come to any one of our health facility, you would have a unique identifier, a unique card. You can present that at any one of our facility, and they would be able to pull up your record. And when the record is there, if they send you, let's say, to do a CT scan, you'll go to that section of the hospital, do the scan, and once that is completed, that scan comes into your record. If you go to the laboratory, they'll be able to do whatever test was ordered, and the lab results come into your record. Um, you you're prescribed uh, certain medication. You go to the pharmacy, you'll pick that up, but that record of the meds that you're using would be there as well. So when you present yourself anywhere, if they need to see what meds you have been using, what your lab results were, all of that would be made available so that you can provide better care for that patient. So ultimately, this is a integrated system that we are working on. These systems do take some time to put in place because of its complexity, but we have, as I said, world-class experts that are giving us assistance to help us to put this together. While we're working at the hospitals and so forth on the coastline, we have also piloted a system in uh, 4 rural community, and this is doing telemedicine. But by doing telemedicine, we also have a system. So when a patient come in, let's say at Guns, where we have one of these sites, and Guns, as you know, is one of the most remote, the remotest village, I would say, in Guyana. So if you go to Guns, a patient present themselves there at Guns. When they come, the computer that the community health worker is using, it has a EMR system that is there so that we can document all the patients that come, what are the complaints, and so forth. And if the community health worker cannot um, diagnose or treat that person, then they can dial up a doctor who is in Georgetown. And that doctor would be able to go through the medical history with the patient and be able to offer guidance. Um, and this system also comes with a number of internet um, enabled devices. So when you put the stethoscope 600 miles away on the patient, the doctor in Georgetown can actually listen to the heartbeat. We can listen to your breath sounds. We have ultrasound probes where they're able to see the image in Georgetown of what is happening in your abdomen, or they can do an ECG 600 miles away. So this is the kind of system that we have, and all that is done in real time. So the doctor who is providing assistance uh, would be able to see these things and make a decision.
Have you already done any of this, or
Yes,
this?
this right now as we speak, this is happening, and that has been happening for the past 6 months. and we are now expanding this. So we were at 4 sites, and we'll be expanding it to 19 sites. And this right now we are in regions 9, but we will very shortly be in regions 1, region 7, regions 8 and 9. So we're trying to go to a very remote area where care is extremely difficult to access. And by putting in this system, it's making a tremendous difference. In fact, over the last December, because we had this connection and the doctors were able to assess the patients remotely, they determined that 2 of these patients needed emergency medical evacuations. And so we sent in the plane. We were able to pick up the patients, bring them to Georgetown, and they got treatment. And because we did that, those patients are alive today.
All right, thank you, Dr. Ganga.
Good evening, everyone. Good evening, Dr. Anthony. In the last 25 minutes, you have outlined quite a lot about the accomplishments you've made with the system you're aiming at in Guyana. That's very commendable. Um, you are focusing on the cases through the diagnosis that you're making with the telemedicine system that's being set up. I want to go back because you've covered so much. I can hardly add to that, but I can go back a little bit. Uh, I was with the Guyana Watch. Dr. Tara headed that, and I was the front desk statistical person. And what I had noticed there was there were about 5 diseases or 5 conditions that if we tackle those directly, it could raise the health standards across the country. And the access was through mobile clinics. So I'm thinking that to provide awareness, access, the diagnosis as well, which would add to telemedicine, the mobile clinics, maybe with a brand name on it, would inform the public about the availability of the services. Sometimes they don't know and they suppress a medical condition, and then later it erupts and it turns undesirable consequences. So the idea of expanding on a basis, mobile clinics, say attached to like the number 7 village clinic that you have, which I looked at the billboard there. It's quite impressive. So we can assist those clinics with a mobile unit, and it could have a brand name there, which would give awareness and visibility for the public to know what you're doing and what services are available. So the
It's
treat,
an idea that we can embrace. One of the things that we used to do before, we had dental buses, and we used to offer dental service by going to various community and offering that. So it's something that we can do, especially in some of the remote areas where it's sometimes difficult to offer certain specialized care. But yeah, that's one of the things that we can
yeah,
certainly.
yeah, yeah. So with the emphasis you have on the disease, we can look at the eye, the ear, the heart, of course, and also conditions. The conditions like diabetes, for example, can complicate things. My
So
brother, who is
one of the things I want to say to you is that let's take eye disease, for example, and people requiring spectacles. We started a program last year that is called Snap On Spectacles. And when we mean snap on, it's literally snap on. So we have there's a guy out of Johns Hopkins who designed a spectacle where they can measure whether or not you're seeing properly and color code the lenses that are there. And so once you do that test, It's a test that would take probably about 3 minutes to do. You will get a color code as to what lens to put in. And then you take that spectacle off and you go to the bag with the different color of lenses and you just snap that on to the spectacle frame, and that person have a pair of glasses right there. So
Oh,
we started this program last year. We gave out about 5,000 spectacles in rural communities, and that is going to continue this year. And another program that we have, having rehabilitated the Port Morant Ophthalmology Hospital, the government, when we just came back in, we spent close to $100 million fixing the operating microscopes and the theaters and so forth, because under the last government they just allowed the thing to run down, and we had to put back all these equipment. And right now we have a program where in the interior we send out teams. They would go, they would screen people for cataract. And once we identify that you have cataract, we put you on a waiting list. We fly you out to Georgetown, bring you down to Port Moran, put you in the hospital, operate on you, fix your cataract, and then send you home back. And that's an ongoing program that we have where lots of people now who never had access to these services are able to get access. Similarly, we have a program now for hearing aids. Before, if you're diagnosed with a hearing problem, you had to pay $65,000 to get a hearing aid. We have made this free. So once you're diagnosed with a hearing problem, we'll give you a hearing aid free of cost. And we started doing that last year. We give to 500 patients. This year, we are planning to do 1,000 hearing aids. In just last month, we gave 250 hearing aids to patients who need them. And I think we'll see this program grow as more and more people learn about the program. So there are lots of very good things that are happening,
mhm.
and it's
Yeah,
happening across the country. And you spoke about diabetes. In fact, we have a team from Mount Sinai who's working with us right now to do national guidelines on diabetes. We have just completed the draft guidelines. We are now going to test that with our physicians. And once everybody is happy, in a month's time, we are going to launch those guidelines. We have created at Lusignan, for example, a one stop diabetic center. So anything dealing with diabetes, you go there, there will be a person there to see you. So if you need an endocrinologist, you can be seen there. If you need to get your eyes checked, you can be seen, that they would be able to do it there. If they need, if diabetic patients, they will have problems with their feet, right? We are able to do those checks. Plus, if you need weight bearing shoes, we can give you that there. So we are trying to package all these services in one place so that you don't have to go different places and wait, have a long waiting time and things like that. And these things are bringing a lot of relief, tremendous relief to patients, which is the whole intention of what we're doing.
and of course, you're also giving huge grants to diabetics on dialysis, right?
Yes, so that's another very good program for patients. As you know, the president, one of the things that he did was to increase the amount of money that we are giving to dialysis patients. Before, it used to be $360 when you're diagnosed, and that's it.
It's a
Finish with it.
one time
One off.
grant.
Right now, every year we give $600,000 to dialysis patients, and last year we actually gave 330 persons $600,000 each. And I'm sure this year it's going to increase. Already we would have given out more than 100 patients for this year, and more are coming in. So again, we will repeat this during this year and maybe add a few more. Last year, for example, it's not only helping dialysis patients, we help a lot of patients. So if they need an MRI and they need some assistance, the government would provide that assistance. If somebody go to the Georgetown Hospital and cannot afford the surgery, let's say that CHI is doing, if they need a stent, the government pays for that stent. If they need a valve replacement and it's done at CHI, the government would pay for it. So last year, we spent more than $900 million assisting close to 3,000 persons with various ailments that needed some financial help. We helped them. I
I
don't
was
think a lot of people understand that.
It's a huge number. If I can add, Dr. Tara and Dr. Ganga,
Mhm.
given that Dr. Frank Anthony, these are more so defensive mechanism in the healthcare sector. I think one of the problems you hear when you're in the US, when you are from a Caribbean background, there's this culture norm of poor diet. Won't the government want to engage in campaigning to educate the population about the dangers of these diseases as a preventative mechanism as well?
Well, our biggest threat now is more the chronic non-communicable diseases, right? So this bunch of diseases, whether it's cardiovascular, diabetes, and so forth, all of them are linked to people's lifestyle. So what they eat, how much they exercise, how much they sleep, what stress they have, these are all factors that can influence chronic non-communicable diseases. And
Yeah.
so we have set up a new department dealing with chronic non-communicable diseases. And we are working on promoting and launching a special program on wellness. So we don't want to wait until you get sick. That's a old time paradigm that we have where people get sick and they come for help. We want to keep you well. So by promoting wellness, this is what would keep people well. So people must understand what they need to eat, how much they can eat, what are the right things to eat. A lot of people like a lot of meat and so forth. That might not necessarily be the right things for you. So we want to explain that, and we are working on a whole set of promotional material that we'll be sharing with the general public. Exercise is another thing, right? Because a lot of people don't get exercise. We have seen the rates of obesity grown in Guyana over a short period of time. There was a time when people used to walk and ride and so forth. Now we have you know um, traffic jams, and at certain hour, just like in the U.S. where you have peak hours, we have peak hours as well, where literally you spend like an hour in these traffic jams. That was unheard of before. So a lot more people are driving, they're not doing exercise, and that's something that we have to get people to understand, that it's important to exercise. So we are working on that. We have a team from the US also that is working with us on promoting wellness. So we are hoping to have a wellness conference in September, and we're working with that team to launch this in September.
are you incorporating yoga in that wellness
Yeah. So
configuration?
one of the things that in this whole scheme of things that you want people to do is to be able to de-stress, and certainly yoga and meditation is one of those things that you want people to do.
I think we can make it more broad based by having the wellness program across the education curriculum from primary education all the way to
Mhm.
secondary.
Yeah,
Right. Indeed, indeed.
also incorporated in the work environment, because many companies here in the US will promote wealth, some level of stipend or promotion if you go to the gym certain amount of times,
Yeah,
because the more you can educate the population to be healthy is the less stress it puts on the health system.
yeah. And one of the things that we want to do, right? We've been working on expanding lifespan, right? Meaning life expectancy. So we have seen with all the improvements and so, that life expectancy has gone up, right? So your lifespan is increasing. But we also want to increase your health span. So you must live a healthy life longer, right? So we don't want people to get sick and then struggle through their years. You can have a healthy lifespan as well if you embrace
Mm.
this wellness concept. Eat right, exercise, stress, manage stress and that sort of thing. So that's the whole idea. A lot of the countries are shifting in this direction, and we want to embrace that as well. I think that's absolutely important.
I just want you to comment on community healthcare workers, how many the PNC had working and how much the PP expanded that by.
So one of the things is that they used to train maybe about 30 persons a year, and that was not enough because we have need for these community health workers in every village. So within the first 2 years of the government, we expanded training. We instead of people having to come to a central point, we took the trainers out into the regions, and we for every health facility in regions 9, regions 1, regions 8 and 7, the village identified two persons, and we were able to train two persons for every health facility that we have in these regions. So in the last 2 years, we probably trained maybe about 250 community health workers. We have employed them. The starting salary now for a community health worker, given that we have increased the salaries for people in the health sector, the starting salary for a community health worker is 100,000 Ghana dollars. And with the salary increases that we've just given in January,
Mm.
registered nurse starts at 169,000. Midwife, a registered nurse midwife would get 219,000. So it's a substantial increase.
Mm.
A doctor with 3 years experience, coming out of med school and having 3 years experience, would start at 450,000 Ghana dollars. A specialist would now get close to $950,000.
Mm.
So we have you know added resources to the people who are providing
Yeah.
help,
I,
and
I, I
and
just want to go back to that question. How many community health workers the PNC had when you took over?
I think less than 100.
Mm.
And in 2 years, we increase it to 250.
Okay.
That's the people that we train.
And one of the things that bother me is that the scanning machine you have at Georgetown Hospital, how many you have?
We have a CT scan at Georgetown Hospital, and we have one at Bartica and one at New Amsterdam, right? Um, the one at Georgetown Hospital, it probably might have cost about 250,000. These were all bought under the PNC. This one,
Mm.
they if you go on the price, it should have been about 250,000 US dollars. They paid close to a million US for it. So something funny happened there. And the other two, the one that are currently at New Amsterdam and Bartica, these were donations. But the one at Bartica, for example, that was the one that they had in the Sussex Street bond. And one of those CT scan, because they're, the low level type of CT scan, they would cost about 30,000 US dollars. And the amount of money that they spent renting that bond, we could have bought, we could have gone out and buy maybe about 10 or 12 CT scan for the amount of money that they spent renting that bond. But that aside now, what this government is doing, we are going to put in the 6 new hospitals that we are building, where each of them would have CT scans in them. So there's a hospital at Lima, right, or near Anna Regina. that one would have a CT scan. There's one at Dekendron, that would have a CT scan. There are two in Region 4, one at Diamond, one at Enmore, they would have CT scans. There's one at Bath, that would have a CT scan. One at Skeldon, CT scan would be there. We are putting in, we are going to upgrade a lot of the hinterland hospitals. So at Lethem, you'll have a CT scan. You will have a CT scan at Mabaruma, one at Maruka. You will have at Bartica. You will have, so all these interior locations would have CT scans. There would be one at Linden, right? And all of these would be interconnected so that the images would be sent to Georgetown, where the radiologist there would be able to interpret it and then send back the results. So you would see over the next 2 to 3 years a tremendous improvement in medical imaging and what we are doing. In addition to that, at the maternal and pediatric hospital, we are putting in an MRI, and that would help to do a lot of the MRI images that we need to do currently. We have an MRI in the private sector here, but we need to have our own one in the public sector. So once that hospital is completed, we'll have an MRI machine. We are also right now training a couple of persons at McMaster's to be able to do interventional radiology. And this would be absolutely essential when we start doing cardiac surgeries and so forth. So you would start seeing these things happening.
What about attrition, staff attrition, doctors, nurses?
Well, one of the reasons why we increase salary is to start dampen that attrition level. So hopefully it would start working. We are seeing an interesting thing where people who are working right now in the private sector in Guyana, some of them are asking to come and work in the public sector. So let's see how that dynamic plays out.
I'd like to just mention the wellness education program should include workplace safety.
Yes.
That would lower pressure on the healthcare system as well.
Yeah.
And I know in one company I worked with, AT&T in the United States, they had a bonus program for the management to benefit from if they had an accident-free year. We had a situation where we had a volleyball game, and one of the managers was so fierce and aggressive, and his department, which I worked there, had one accident, and that head of that department did not get any bonus that
No.
year. So it's a big incentive for management to ensure the rules are observed for workplace safety.
Yeah. No, definitely. And through Ministry of Labor, they have also been promoting occupational health and safety. And they've been encouraging all the organizations, both public and private, to set up safety committees as is required by the law. But another area that we have started working on is to look at screening in schools. So we have been working with Ministry of Education, and our intention is that every school child, as you come into the school system, you would be screened. We want to check your eyes, check your hearing, look at your mouth to see if you got any dental problems, and to screen you generally to see whether or not you have any health issues. If we detect those early, then we can put things in place to help that child. So that is something we'll start a pilot this year, and hopefully we'll be able to scale that up so that every school child would benefit from that program.
Okay. The New Amsterdam, Linden, and Surrey Hospital are due for rehabilitation. Is that right?
New Amsterdam, we are working on a different solution. We might not rehabilitate it. We are looking at whether to do another hospital there. and convert that facility into something else. But these are all discussions that we are having. Nothing has been settled as yet.
But
Linden certainly would be under redevelopment, and to make sure that we can enhance the capacity of Linden Hospital. Because we are putting in a new hospital near Anna Regina, um, we would not we would maintain facilities at Suddy, but you would have a modern hospital next to Anna Regina.
Mhm.
Bartica Hospital will be upgrading substantially, and um, right now we have completed the designs for Bartica.
Mhm.
So later in the year we should start working on that,
And
which I'm
how are the plans for the specialty hospital, the maternity hospital up in East Coast? How is that coming up?
that we are making good progress. We have handed over the site to the contractor. As you know, that the contracting firm is Vamed. This is an Austrian company. So they have taken over the site. In another couple of weeks, we should have piles start going into the ground.
Mm.
And so they're on their way in terms of the construction.
And can you give our viewers an update on the COVID, the malaria, and the HIV situation in Guyana?
Sure. So with COVID right now, we don't have any hospitalized patients. We do have a couple of persons who have tested positive, but we don't have anybody in hospital right now. Um, so that's a good thing. And more recently, we received through UNICEF 5,040 boxes of Paxlovid. So if people are diagnosed, we can treat them, which would help to,
Mm.
reduce the severity of the cases. So we have Paxlovid available. We have vaccines available to help prevent. But I guess a lot of people right now, they're not coming forward to get the vaccine. There's a hesitancy, not just in Guyana, but around the world. And we have seen that happening here as well. In terms of malaria, this is another area that we've been working hard on. And we have distributed bed nets in communities that are severely affected by malaria. And we have been working with the population to reduce the amount of cases. We have trained lots of people to do microscopy so that we can make diagnosis. If anybody got fever and they come, we can do the diagnosis. But we have also introduced rapid kits. So with a blood prick, they would be able to see whether you have malaria or not. So we have been introducing these new innovations, and they've been working very well. And of course, providing medication in all of these communities where malaria is endemic. So lots of work has been going on, and we have put a lot of investment into this. In terms of HIV, as you know, we this is an area that the government has been providing antiretroviral treatments for all our patients. Uh, about a year ago, we adopted self-testing, so moving away from VCT, which is the traditional method of doing testing, to one where people can get the kits and test themselves. And if you're positive, you come in, and we have an algorithm that we go through, and you'll get treatment.
Is
We've
the
also
incident
introduced,
is the incidence increasing?
not really, but we do have a number of cases, and we are committed to making sure that everybody get their meds.
All right.
What we are also doing is that for those persons who are currently infected, if we can treat you where we are not able to detect the virus, then that's a good thing because that helps with the prevention and help to prevent
Mm.
spread of the disease. So we recently bought a viral load machine, and that's operational. So we can now do viral loads to measure the level of virus in you know
Mm.
persons who are infected to see whether we have suppressed the virus. And that's a very important way of controlling the disease. So we have put in a lot of measures. Over the last 2 years, a lot of things have happened, including introducing PMT, introduce PrEP. This is pre-exposure prophylaxis. And so if anybody feel that they're at risk, we would be able to give you treatment to prevent you from getting infected. So this is something that has been we have introduced, and we have been working on this, getting more people to adopt it.
Mm. All right. We're out of time. Dr. Ganga, your last comment and question to the
Yes, I
minister.
noted that the IDB did a very broad-based study across all the regions. I think that could provide useful guidelines if you extract the data, or if they have the data somewhere of the disease and the incidence of risks for that disease. That would provide a very useful
So, so that
report.
study was done because we were working with the IDB to secure a loan. So we have just signed in December a loan with the IDB for 97 million US dollars, and those the monies are going to go to upgrade all the hinterland hospitals.
Well, it's a broad-based study. We need to look at it perhaps to go across all the clinics elsewhere as
Sure.
well. Otherwise, people will say, oh, it's political and so forth. But it's a broad-based study. They would be able to provide the data for the other communities.
Yeah, sure.
Uh,
Yeah,
Professor Mahan.
yeah, Dr. Anthony, quick question. If you ask different sections of the population, they will praise the healthcare. Some people will complain about the service they receive. But how often do you receive a report at your level as minister of the minister of that sector to examine how the sector is performing? You spoke about the facilities and technical standard, but some folks will look at the hospital facilities across the country and they will say, well, it's not kept up to standard. Are you in constant receipt and review of these things?
Yeah, we do constant review. It's something that we have built into the system. So while we push ahead, we have to evaluate, and we are holding people accountable as well. So it is important for us to do that.
All
And the
right.
reason why we've been able to accomplish so much, it is because we have been holding people accountable and making
Okay.
sure that services are being delivered.
Gentlemen, Dr. Frank has to go, but I think you have the Chinese brigade currently at the Georgia hospital.
Yes.
Dr. Frank, you want to make your final thing before you head off for the airport?
Yeah,
Any
I think
final comment?
there are lots of development in the health sector in Guyana, and we are very excited. The staff of the ministry is very excited, and we are working with the president's vision of building that world-class healthcare system, and we believe that we can do it. And you start seeing some signs of that happening with the types of complex operations and so that we've been doing. And this is going to continue. So we want people to, we know that not everything is perfect, but we are working to fix those challenges while at the same time have a vision in mind of where we can go. And we intend over the next couple of years to change how people view Guyana, how people view the health sector. And we strongly believe that in the next coming years, that a lot of people from the Caribbean and so forth would want to come to Guyana to access healthcare. And that's what we're working on. So you will see a lot of transformation. And I hope that with this type of transformation, you know, people would be more reassured that they can come to Guyana and be able to get high quality of care.
Thank you very much,
Thank you very much.
Dr. Anthony. And we have to get you here
Yeah.
because there are so many other questions we need to probe. But we want to thank you very much and all the best to you and to my colleagues, Dr. Ganga Ramdas, Professor Mahin Hariraj. We'll see each other probably in another week's time. So thank you and good night. Good night to our viewers.
Safe trip, Dr. Anthony.
Good night, everyone.
Well, he's just going to the airport. He's not leaving the country. He's going to receive a delegation from the U.S., right?
Yes, yes.
Mm-hmm.
All right. Bye, guys.
Dr. All the best. Good night.
Good.